Dr. Robert Baker of Walsh Urology is here with us. We're going to talk about the importance of prostate health. So men, listen up. How are you?
Pretty good.
Nice
Good
to see you.
Pleasure to be here this afternoon.
Yeah, last time I was on your turf, now you're in my home.
Exactly.
Welcome to you. All right, so we're talking about the prostate. My first question for you, how does the prostate change as men age?
As men age, generally the prostate will increase in size. So if you kind of think about a visual would be that when you're in your younger years, the prostate would be the size of maybe a walnut. Mm-hmm. As we progress in time, the 30s, 40s, it start to get about the size of an apricot. And then when you got to your 60s and above, probably the size of a lemon would be something as a visual to look. So other than aging and increase in size, the potential for things like prostatitis, inflammatory conditions in the prostate, obstructive problems caused by the prostate, and then that number one thing that everybody thinks about in terms of prostate cancer, the probability of that increases with age.
I see. Okay. So what are some common prostate conditions that men actually deal with?
The most common is that when we get obstructive symptoms caused by prostatic enlargement, okay, and those will be usually reflected in terms of one's stream, the frequency that one has to urinate with, the ability to empty the bladder or not, pain, discomfort with urinations. Those seem to be the major ones that affect us as we get older. They can be also an effect on the bladder in terms of causing, they think of the bladder as a muscle, and if it's working against a obstructed outflow, such as the prostatic urethra, that's going to cause the bladder not only to become tired, to work harder, to become thicker, and cause some actual issues in terms of irritability, which can manifest itself as urgency frequency. So we have both storage issues that can happen because of prostatic problems or enlargement, and then we have also flow problems that can happen.
So I know you described a couple of obvious symptoms. Are there some symptoms that aren't too obvious?
Sometimes people will have a more than flow issues, inflammatory conditions chronically in the prostate. They give more pelvic discomfort in terms of achiness, problems with achiness in the scrotum, sometimes in the inner thighs, even in the suprapubic or the lower abdominal area, and even the back. That will all manifest as because of inflammatory issues or issues in the prostate itself.
Okay. Since we had that up, well, we just lost it. No biggie. Tell me about how BPH. There we go. Thank you, guys. Explain how BPH is treated.
Okay, so we look at BPH as a number of ways to treat. So this is basically an increase in the prostatic tissue size, all right, which now causes, if you're looking at that diagram there, obstruction to the outflow, the prostatic urethra itself. All right, so this is a mechanical problem, all right, and what we're trying to do is treat it mechanically. If we use medications, then medications to either enhance or open up the outflow would be the course, such as the alpha blocker medications. Another form of medication that can be used are what we call the reductase medications, which actually shrink the prostate down. So all of these things are being done in order to enhance outflow.
Okay, all right. I really appreciate you being here. Register for upcoming free men's health seminar by calling 855-564-9722. Big thanks to the doctor for being here. I learned a lot, men. Listen up, go to Walsh Urology. Take care of yourselves. You can find Walsh Urology in Rancho Mirage. Schedule an appointment or consultation by giving them a call or check out their website, walshurology.com. Again, a big thanks to Dr. Baker and a big thanks to you. Go get checked out, and we'll see you after the break.